Hello, welcome everyone. My name is Fong Pham. I am the Director of Educations at the Harvard Humanitarian Initiative, also an Associate Professor at the Harvard T.H. Chan School of Public Health and the Harvard Medical School. I have today the pleasure of moderating this panel and introducing our two guest speakers today. Thank you for joining. Today, we're going to talk about humanitarian funding, forecasting, and anticipatory actions. And we have two colleagues at working with OCHA. Um, One is Dr. Nicolas uh, Ross. He is also HHI's visiting scientist and the head of programs for the Central Response Fund. And we also have Regina Omlar, who is the anticipatory lead and also with the Central Emergency Response Fund, the CERFs. Um, I am going to briefly introduce them both, and then I'm going to hand over the microphone to them. And just a little bit of housekeeping. We have the Q&A panel open. And so if you have any questions throughout the uh, webinar, feel free to pose your questions there. And then at the end, we'll reserve 10 minutes for Q&A, and we're going to moderate those Q&A there. But please do, as you know, questions arise, please feel free to put your questions there. And I think during the Q&A, if you have also other questions, feel free to raise your hand or put it in the Q&A sessions. For those who just joined us, I'm with the Harvard Humanitarian Initiative. It is an interfaculty initiative at Harvard University, which means that anything that deals with education's research or policy programs pertaining to humanitarian issues, we host those events and activities. So we have our first speaker is Nico Rost. As I mentioned, he is a visiting scientist at the Harvard Humanitarian Initiative. He focuses on early warning signs on humanitarian crisis. This is closely linked to his work as head of the programs at the UN's Global Humanitarian Fund, the Central Emergency Funds called CERF. And at CERF, Nico has worked on providing humanitarian financing as early as possible, including early actions and anticipatory actions. I think I was going to define that here, but I think Nico does a much better job at explaining that. So I'm going to let him do that, which really relies on predicting shocks before they occur. Previously, he had worked on evaluations on humanitarian programs, on coordinating development programs in Palestine, humanitarian funds in Somalia, and the Central African Republic and Yemen, and for the UN's refugee agencies in Central African Republic and Geneva. And then we have a second panelist who is Regina Omlor. She worked closely with Nico, and she is the anticipatory action lead, and she had previously worked in Kenya and East Africa, leading these activities there. So I think without further ado, I'll hand it over to our two experts on these subjects. And thank you and welcome both Nico and Regina. So happy to have you.
Thank you so much, Fong.
Thank you very much, Fong. Thanks for this introduction and for the invitation. Very glad to be here. And I think we can get started, Nico, right? Perfect. So just to say a huge welcome to everyone. Thank you for your interest in this topic and for joining us today. Again, my name is Regina, and I'm going to get us started with a little bit of some of the foundations of the work that we do at OCHA with the Central Emergency Response Fund and with lots and lots of partners in the humanitarian sector. And we also would like to give you a few examples of sort of, very recent examples of where you can sort of see and understand the anticipatory action work, how it relates to the funding decisions that we work on. And then, at the end, we're very happy to dive into a discussion with all of you to, hear from you and are happy to discuss some questions as well. So without further ado, let me just get started with some of the very basics. I think before we talk about what anticipatory action is and what some of the key definitions are, it's interesting to also just remind ourselves of the why we really do this sort of work and why we are trying to act as early as we can. So let's get started with the first slide. So essentially, why anticipatory action? We brought you a little image from a Dutch cartoonist who does great work on climate change and also humanitarian assistance. And essentially, if you look at this, right, like I think most of you will have some sort of reaction to this. This is a very sort of a very basic way to describe, the work that we do and the rationale behind it. So essentially, what do we see here? If we break it down, we really do see a crisis, right? A crisis situation. We see a crisis that could have been prevented with, different tools and strategies. We see, for example, that if someone had, I don't know, monitored the road, if someone had analyzed the situation, had communicated about the imminent risk that lies ahead, then those people that are, affected in the situation could have, decided together to either get off the bus or take a different route. So essentially, because none of this was in place before and ahead of time, we're looking at a situation that is sort of a catastrophic consequence of not having these things in place before, of not doing the analysis ahead of time, of not, agreeing together what to do and how to communicate. And so that's really one of the major rationale that lies behind anticipatory humanitarian action. And the irony in this image, of course, is that, the affected people are still trying to figure things out while it's already too late, right? And so this is exactly what we're trying to avoid with financing humanitarian assistance that is anticipatory for predictable shocks. And so let's get now into the actual definitions so that we all have the same idea of what we're talking about. So here you can see again an image that sort of shows you the trajectory in the curve of traditional humanitarian response, where of course the crisis occurs and all the wheels are set in motion afterwards. And then you see the blue one, the anticipatory trajectory, where again, things are put in place ahead of time to essentially reduce the impact or the humanitarian consequences of a certain shock that is predictable. So if we look at the three main parameters that we always are concerned about at the CERF, when we're deciding to finance and support anticipatory action, the main objective really is to reduce the potential impacts of any predictable hazard. At OCHA and with the CERF, we do this for, climate-induced, crises, that's droughts, floods, tropical cyclones, as well as disease outbreaks. And currently we're working on cholera. The second point is here that any action that is put in place by humanitarian organizations is really mostly based on forecasts or any sort of predictive analysis, right, of the hazard itself, how it might develop, where it might strike, who might be affected, what severity level are we looking at, and things of that nature. Now, we do have some small instances where sometimes we include indicators that look at observational data, in cases where acting ahead might not always be possible. What we're still worried about is how can we act as fast as possible, even, if it's not based on a forecast. And then the third point really is that the goal is to have, life-saving humanitarian action put in place before the hazard occurs. And if that's not possible, then at the very least, before the most acute humanitarian impacts are felt by the population that is at greatest risk. So essentially, that means that we try to work with a multitude of partners, including the governments of the country that the situation occurs, to make sure that everybody knows what to do, where to go, and what to deliver, so that we have no decision making to do at the point of crisis, or the crisis is imminent, and things can be put in place well ahead of time. And if we go forward, the next slide, we just wanted to give you also, the sort of the very concise, definition here. As you can see, we're talking about acting ahead of anything that's predicted or before the peak impact, to prevent or at least reduce acute humanitarian consequences before they are fully felt by the population. And at OCHA, we look at 4 key parameters, and that is also, I would say, best practice in the sector. So we share these with most of the partners that we work with that are also at the forefront of putting in place anticipatory humanitarian action. And so first, these are the pre-agreed triggers. So these are really any sort of thresholds of indicators and decision-making rules that are based on reliable data, timely data that is available and accessible to us, very easily, and that are measurable, right? So we look at forecasts when it comes to flooding, for example, or drought. Of course, we look at forecasts for the rainy season that lies ahead. We look, for indicators that tell us that the rainy season will be above average, below average, and how much below or how much above. That it gives us the clue about the severity levels. And then when it comes to tropical cyclones, for example, we look at, of course, the forecasting of these cyclonic systems that form in different parts of the world. When it comes to the prearranged financing, this is, of course, where we at the CERF, are sort of working at the core of the financing question. The benefit here is we are not waiting for the information about how bad a situation is. We're relying on the risk analysis, the data, all the pre-analysis that can be done to commit financing ahead of time, so that the partners on the ground have the planning security, that they know that if a situation occurs that is as severe as X, then we know there will be financing of that amount for X and Y partners to do X, Y, and Z. So that's really where the prearranged financing comes in to fuel the humanitarian anticipatory action. And then we have the activities. Again, everything is pre-planned. We work with partners that are very well versed in the local context, that have local partners that know what can actually help in advance. And so we set up, action plans and really projects ahead of time, so that we know what's most efficient and feasible even, right, to get done ahead of a flood or ahead of a hurricane that's coming. And really the key here is that those actions are implemented in that window of opportunity that lies between we have the forecast, we know what's going to happen, and the shock will occur or the impact will be felt. So there is a time frame that's different based on the shock that we're discussing. That can be a few days in situations of a cyclone or typhoon or hurricane. And that can be, maybe 2 weeks when it comes to a flood. And of course, a much longer lead time when we're talking about droughts. And then at OCHA specifically, and with the CERF, we're very much concerned about also the fourth option that we sort of added along the way. And that's a learning component. We are really in the business of trying to learn from our experiences, our successes, but of course also from things that didn't go as well. And so we're really in an iterative learning process as we go along. We've been doing this work for about 5 to 6 years, and every time we have an activation or an anticipatory action allocation, we learn something. And so we really want to invest in learning as well. And so sometimes we can also engage, external research institutions to help us do these evaluations that are independent and insightful. So if we go to the next slide, this is essentially, well, here I have just summarized, but you can see that. If we go to the next slide here, we can see that most of that, what I've just described, is sort of animated here. We see the difference between the traditional response, right, and anticipatory action. Here we have a severe crisis that's happening, and usually after that, all the motions are happening, right? We are trying to understand the needs. Once a shock has occurred, a crisis has happened. We're doing needs assessment. We're trying to make sense of the data. We're trying to understand where to go, who to assist, and what to do. And that's a planning and prioritizing sort of process. Usually the deliverable out of that is a humanitarian response plan, a flash appeal, something of that nature. And then we're going to the donors with this information and saying, we need X amount to help X population after, this situation. And so this is sort of the traditional way. And then we at some point have the delivery of aid. Now, sometimes this is weeks. There's also situation where this could be months. But in anticipatory action, what we're trying to do now is essentially take these three elements and pull them forward. We are essentially changing them. Instead of analyzing needs after the fact, we do a risk analysis before. There are certain countries that are always at risk of a certain shock. We look at forecasting, what is available. We also decide on what threshold is appropriate to act, right? And pre-agree on all of this in a protocol. And instead of planning and prioritizing after the things, the situation has occurred, we work on pre-establishing these action plans that we just discussed, right? So that everyone knows what to do when we know that a crisis is imminent. And instead, of course, of mobilizing funds after the fact, we're working on providing pre-arranged financing so people have the security to know that if a situation arises and it has a certain severity level, that the funding will be there automatically, no further decision making needed. And we pull these three elements forward, right? So you see it in the next motion. We pull it forward. And what do we do then? We monitor. We monitor either the rainy season, that's 3, 4, 5 months ahead, or we monitor the typhoon season, for example, the hurricane season. We monitor, we look at the data, we look at the forecast and what we can gain from that information. And once we see that at some point in the future, it could be days, it could be weeks, it could be months, depending on the situation and the exact shock. When we know that this crisis is very likely to be severe for the population in question, that's when we put in place the anticipatory action plan that we agreed on in advance with the funding that was prearranged. And the hope is always that this will mitigate whatever humanitarian consequences would have arisen from this humanitarian crisis. And of course, the goal is to have a much reduced crisis and a much reduced impact on the population. So essentially, this was just to summarize some of the things mentioned earlier. And I think just to round up the sort of foundation laying here, what's the rationale again? This is basically to reduce any humanitarian consequences or impact. And also very important for the Central Emergency Response Fund, we have also seen from various evaluations that really, acting ahead of time, putting prevention measures in place before is much less costly than responding after the fact. And that, of course, is something in the day and age that we are in right now is very key. We have interesting evaluations that we can share where, you can see that the response costs are much higher. But even if you think about it, waiting until roads are flooded and you have to airlift, for example, humanitarian supplies is much more costly than, making sure that people get what they need ahead of time. And then secondly, of course, it is more dignified. When we have the information that human suffering is imminent, there is really, we have the humanitarian imperative to act. And so this will be, of course, much more dignified for the population that we're trying to assist. And then lastly, in this work, we always have to, work with all of the elements that are part of an ecosystem of a population. And so humanitarian assistance is one thing, but there's also a lot of work that is done by development partners, by other organizations that are trying to really work on longer term solutions for the societies in question. And doing humanitarian assistance when we can in a much smarter way, that will help development partners protect their gains as well in the long term. So with that, I think I will hand over to Nico for the next portion. Thank you very much.
Thank you, Regina. And also from my side, thanks to everybody for taking the time to be here and to participate in this discussion of anticipatory action. So I wanted to start by giving an example of anticipatory action. So last year on the 4th of July, the trigger for flooding in Bangladesh reached its threshold and the anticipatory action framework was activated. Quick side note, Bangladesh also activated in 2020, and it was also on the 4th of July. So we're getting a little superstitious here. We'll see what happens in the future. And so because everything was planned ahead of time and everything was arranged ahead of time, as Regina explained, all we had to do at this moment was to click a few buttons in our grant management system and let the agencies, the UN agencies that we fund, let them know that they could start with the implementation of their activities and that they would receive the funding from CERF, from the UN's Global Humanitarian Fund, within a matter of days. But they could start providing assistance to people immediately. And so within 16 minutes of the trigger going off, we had notified the agencies that they could start working, and they did. So within a few days before the flooding in the areas that we covered reached its peak, they had implemented almost all the activities that we had planned for. And this includes mobile cash, which is one of those activities that are very useful for anticipatory action because it can be done so quickly because it's digital. And so they were able to reach 400,000 people before they were affected by the worst flooding. And then WFP conducted an impact evaluation of this particular activation. And what they found is when they compared those people who received anticipatory action to other groups of people who received assistance, but they received it later, is that anticipatory action helped improve people's preparedness. So they were better prepared themselves for the flooding that was to come. They had better food security outcomes, and especially they had better food security outcomes during the critical phase during the flooding. So as you can see on the chart, after about 3 months, the outcomes kind of became very similar for the different groups. But during the critical time when they were affected by the flooding, people who received this kind of assistance had better food security and also better mental health that they reported in this evaluation. So we do have a number of impact evaluations and other learning outcomes. Those are all publicly available on our website, and there's by now a lot of evidence that anticipatory action leads to better outcomes for people affected by humanitarian emergencies. So I'll mostly talk specifically about the role of CERF, the Global Fund, in supporting anticipatory action. And to start, I want to go back to the mandate of CERF. So CERF was established 25 years ago by the UN General Assembly. And the General Assembly formulated these three objectives for this new fund at the time. And the first one is to promote early action, which is, almost a synonym for anticipatory action. So this idea of acting early, of even acting ahead of time, was baked into, the setup of this fund from the beginning. In CERF, we have, based on these objectives, we have developed clear criteria, pretty detailed criteria that say what kind of activities we can fund and what we typically don't fund. And, CERF covers a specific niche. CERF is there for life-saving humanitarian action in the short term. Yes, we work together with other partner organizations who provide longer-term assistance, or who have longer-term programs more focused on recovery or resilience or development. But CERF is really there for this short-term humanitarian assistance, and that is also one of the advantages of CERF with regard to anticipatory action. We can just react very quickly, as I mentioned before, and get funding to the most affected people in the most affected places, and especially also for climate disasters, which is most of what our anticipatory action portfolio covers, as I'll show later. So about 5, 6 years ago, we started to work on the specific work stream on anticipatory action to set up dedicated frameworks around the world. I'll show in the next slides how this has developed over time and how we've scaled up anticipatory action globally. But first, let's look at all the anticipatory action frameworks. So this is not just CERF, but this is all the different partners. So UN agencies, NGOs, the Red Cross, Red Crescent movement around the world. And as you can see, there's quite a lot, and they cover lots of different types of emergencies or different types of shocks. In the CERF Secretariat, we focus on a specific subset. We focus on hydrometeorological disasters, so drought, floods, and storms mostly. And also, we have 2 frameworks, one that's in place and one that's under development for cholera, so a disease outbreak. What's interesting is that about 50% of the global funding that's pre-arranged for anticipatory action, so that's in place in case something happens, was provided by CERF last year. And this makes CERF the largest provider of anticipatory action globally. OCHA, in addition to managing the CERF, which is this global fund, also manages country and regional funds, typically in those countries with protracted humanitarian crisis. So countries such as the Congo or Sudan or South Sudan or Yemen. And these funds are also increasingly supporting anticipatory action. So last year, for example, we had 10 million from the Afghanistan Humanitarian Fund, together with the CERF allocation supporting anticipatory action for drought in that country. While CERF and OCHA, together with the country funds, is the biggest provider of financing for anticipatory action at the moment, we do work very closely with our partners, and many of our partners have started to work on anticipatory action earlier than we did, so longer ago than the 5 or 6 years that we have been working on this. And so there's a strong sort of sense of community in the anticipatory action space, where everybody tries to learn from each other, learn from the successes, but also the failures, the activations that didn't go well, the false alarms, and so on, to really improve how we set up these frameworks. We also trying to use each other's analyses and triggers where we can. So for example, in the Philippines, we've been using for a trigger developed by the Red Cross, Red Crescent movement for a long time. And other organizations are using our triggers in some instances. So we really try to work together where we can. And the way that with CERF we've worked to scale up anticipatory action is threefold. And I'll explain this on the next slide. So the first thing that we've tried to do is to provide more financing for anticipatory action. So the anticipatory action allocations that we do have ranged up to more than 20 million. Some of them are smaller, but the biggest ones were pretty significant. And so this was more funding going to AA than was the case before. We've also, because we work for OCHA, which is the UN entity that tries to coordinate the whole humanitarian system, we're also bringing together different partners where we can, and we try to coordinate anticipatory action so that we have developed multi-agency, multi-partner, and multi-sector frameworks, as opposed to single sector or single agency frameworks. On this map, you can see anticipatory action frameworks that OCHA is working on. Many of these are backed by CERF, but not all of them. And as I mentioned, most of these are focused on hydrometeorological disasters, so storms, floods, and drought. And we have those two frameworks from CERF that we support for cholera in the Congo, Democratic Republic of the Congo, and in Mozambique, which is under development. Currently, we're supporting 25 frameworks in 20 countries. So there are several countries where we support two frameworks. So for example, for drought and for flooding, or for storms and for flooding in Bangladesh, for example. And we have currently pre-arranged $125 million. That doesn't mean that we are allocating all of this money at once. This is only in case those frameworks trigger, in which case we provide this funding automatically without making any further decisions. In total, we've dispersed 140 million over the years. And as we've mentioned, learning and improving the way that we set up these frameworks step by step is really important to us. So there's more than 40 learning reports and evaluation reports and other reports that are available, and we always try to apply those lessons learned to the next framework that we set up, or when we revise the framework. A few key considerations. So again, CERF has a specific niche. We come in when a disaster reaches a certain scale or magnitude. So we typically fund anticipatory action for disasters that don't happen here, but happen maybe every 3 to 5 years. There are other mechanisms for sort of the average flooding or the average storm that happens on average every year. As I mentioned, we really focus on collective and multi-sector anticipatory action, not on single agency, single sector responses, to provide a more comprehensive response for affected people. The life-saving criteria, I mentioned them before. There's a specific set of activities that we fund, and we try to be as anticipatory as possible and only as reactive as necessary. And our work on anticipatory action, and we are benefiting from that work to also make better rapid response allocations, reactive allocations where we can. So we'll hear an example about hurricanes in the Caribbean later, but there are other examples where we have used the tools that we've developed for anticipatory action to also better inform our regular response allocations. We try to be as flexible as possible. I'll talk more about this later, how we can kind of build in flexibility into our frameworks. And of course, we have to bring our anticipatory action work in line with CERF's regular financing structure, our standard processes and criteria. But on these last 3 points, CERF is very well placed to fund anticipatory action because we are flexible and we can, as I mentioned, we can act very fast. So financing for anticipatory actions. So here's another cartoon. The key message here is that financing for anticipatory action, it's based on risk, which means it's based on probabilities. Before an event happens, even if we have very strong forecasts with high accuracy, high historical accuracy, we can never be 100% sure that an event actually will happen or will happen at the magnitude that is forecasted. And vice versa, it is possible that the forecast could miss an event that does happen. For example, with tropical storms, they often, take a sharp turn that wasn't foreseen by the forecasting models, or they could intensify very rapidly just before landfall. And so, we in the CERF Secretariat, we know that by funding anticipatory action, we do make these decisions based on a certain level of risk, and we take that into account in our financing. But we are able to absorb this risk because we model it very, very carefully. So we have a good overview of the risk that we are exposed to and how it's distributed. And we also build different mechanisms into our anticipatory frameworks to manage this risk better. So for example, we have frameworks where we split the funding allocations into different phases. So if a first trigger goes off for something, then we provide a certain amount of money, a first envelope, and then only if a second trigger confirms that it's a very severe drought, for example, do we release the second tranche of the funding. Or we have what's called a readiness trigger, so a first signal for agencies to get ready, but they can only use a small amount of the funding to put everything in place. And only once a later trigger confirms that an event is very likely, can they use all the money. And this is, of course, because the earlier you try to forecast something, the less certainty there is that there is around that forecast. On the flip side, we also want to make sure that we don't miss something happening. And so in some of the frameworks, we have a fail-safe built in, which is a trigger that's based on observational data. So if the forecast for a rainy season misses the fact that it's a poor rainy season, that there is too little rain for the crops, then we have an observational trigger during the rainy season. And if we see that there's too little rainfall, then we would still activate an anticipatory action framework and provide the funding to provide the funding as early as possible, even if it wasn't before the rainy season in this case. And again, there are other pooled funding mechanisms that support anticipatory action. So OCHA's country and regional funds, but also the fund of the Federation of the Red Cross Red Crescent Societies, the DREF, the START Fund of the NGOs, and individual UN agencies such as WFP and FAO, for example. So what could be some of the challenges with anticipatory action? I see that there are already a lot of questions in the chat, and we'll get to those during our Q&A. But if you want, put in a few comments on what are some potential challenges with anticipatory action. What do you think could go wrong when we try to provide funding to implement action before an event happens? Give you just a few seconds if anybody wants to put any ideas in the chat. All right, so here's one cartoon to illustrate one challenge. So in many cases, we have early warning signals, but what is still tricky in many instances is then to link an early warning signal to early action. So it still happens that we have a signal that something is happening, but because the systems are not in place, or because there's not the political will, or there's not the will to take on the risk of acting early, there is too little action before something happens. So for us, we've made it very clear that if we set up these early warning systems, these triggers, then these have to be linked to early financing and to early action. And second, there is the risk of providing funding, and then for whatever reason, the event is not as bad as the forecast had told us. So here, I mean, in addition to the mechanisms that I explained earlier, we also focus on those countries that already have high humanitarian needs, and we provide our funding on a no regrets basis. So yes, there is a risk that an event is not as bad as it was forecasted to be, but we know that there are still severe humanitarian needs in those contexts that we work in, and so on average, because anticipatory action is more cost effective than acting after something has happened, we still think that even if this should be the case in one occasion, and I think that hasn't really happened in the case of CERF so far, we would still be fine with accepting a risk like this because of the context that we work on. So these are two challenges. There are, of course, many more. We go into detail of them in our learning products and elsewhere. But we wanted to end this presentation with another concrete example. And for this, I'll hand back over to you, Regina.
Thanks very much, Nico. And just to say, the chat is very exciting. I've been trying to answer as you go along, but looking forward to getting to those questions in a second. So yeah, as we wanted to just sort of close out the former presentation with the most recent example that you all will have heard about, and that was Hurricane Melissa, that essentially devastated multiple parts of the Caribbean just the other week. And so you can see here, parts of the forecasting that we looked at, but you can also see the three, I would say, most affected countries. That's Cuba, Haiti, and Jamaica. And two of those, Cuba and Haiti, luckily we had an interagency sort of OCHA facilitated anticipatory action framework in place ahead of time, ahead of the season. That's CERF funded. So essentially, where CERF in advance had prearranged or pre-committed funding in the event that a major hurricane would affect any of those two countries. For Jamaica, such a anticipatory action framework in and of itself was not available or is not available, does not exist. However, because OCHA had been monitoring the trajectory and the development of Melissa for the other two countries, we were very early on sort of informed about the potential impact on Jamaica by this hurricane. So we were able to act with the rest of the work. CERF also funds regular traditional humanitarian response and other things. So we were able to use the monitoring, the analysis, the forecasting to also support Jamaica. So if we move one slide, the second to last, we just wanted to, if you just click once, you can see here sort of from Tuesday, October 21st, how the hurricane sort of developed. It started, of course, as a tropical storm, and you can see the different color codes here, stand either for a tropical storm watch, hurricane warning, but you see the sort of the trajectory of Hurricane Melissa and how it ended up sort of going over, making landfall in Jamaica, then Cuba, and then continuing onwards, from there on. And if we look at that, and it's a bit hard to do this at the same time, but we wanted to just show you that with the next few sort of slides on Tuesday, when we first had the first essentially forecast out on Tuesday, October 21st. And this is where the readiness trigger, we do have readiness and action trigger, and that's a bit too detailed maybe, but we can explain further. For Haiti went off right away. So at that point, you can see here there was a hurricane watch in place for the southern part of Haiti. And at that time, our pre-agreed trigger went off and told us that this framework and the associated projects and implementing partners are ready, and the money essentially went out immediately. I think it took us for this one an hour or so. And then on Wednesday, I think, less than 24 hours later, the action trigger reached for Haiti. And that means essentially that we're in full anticipatory action mode, and every action plan that we had pre-agreed is put in place. The readiness trigger gives us an early warning sign, and we fund a little bit of, early warning messages, for example, for the population. We fund evacuations, but it might be that a readiness activation occurs, but not an action. So that means that maybe the storm made a detour, and essentially the impact won't be this bad. So this is how we deal with this sort of situation. And then a couple days later, on Friday, 24th, we had the same scenario, but this time for Cuba. As the storm moved closer and closer, the readiness trigger for Cuba activated, and then shortly thereafter, I think it was on Sunday, the action trigger was also reached for Cuba, and this is about 4 days out from the actual landfall, which of course is helpful in actually still having time to evacuate people ahead of time. So this is just something that is sort of the most recent, and what we wanted to show when it comes to Jamaica, because this is sort of a case where we don't have anticipatory action frameworks in all of the countries that are vulnerable to these shocks, of course, but because we do have for over 20 of those countries, we have monitoring, forecasting, analysis, predictive analysis in place that can actually help us. And in this case, all of the work done for Melissa, for Cuba and Haiti was actually helping us for Jamaica. So we have a Center for Humanitarian Data within OCHA, and those colleagues who are all data scientists, they flagged as early as the 23rd of October, when Melissa was still pretty far away from Jamaica, that this, based on historic analysis on previous situations, this could end up being a pretty historic storm with major impact in Jamaica. And so we were able, in our line of work at the CERF, we monitor crises all around, and we have a watch list. And so we were able to be alert about Jamaica very early on. And then as we go forward, our colleagues actually gave us this is just one analysis they provided to us, which was very helpful. And this essentially is a historic analysis for Jamaica on about essentially previous storms since 2000, I want to say. So 25 years worth of storm data in different levels. And essentially on the X axis, you have the wind speed, on the Y, you have the rainfall. And because a lot of the times it's not just the wind that brings destruction from hurricanes, but it's also the rain that is sort of brought by the storm. And so when we can see the size of the bubble essentially is proportional to the total number affected. And here we see that there were major storms in the past, But Melissa, which is sort of marked in the top right corner in green, is, was at that moment set to really, surpass and exceed all the indicators of the previous storm. So that gave us a very early indication that what we're looking at for Jamaica might be really, really bad, and that we need to get ready to act pretty soon. Essentially, when we do not have an anticipatory action framework, then we do as early as possible. But of course, this would be a post-shock response. But again, I think if you just click the last portion here, I think there you can see that on Tuesday, on 28th of October, Melissa made landfall in Jamaica as a catastrophic Category 5, storm, which has been the strongest ever on the island. And about 4 or 5 days later, we were able to still make an allocation that would support life-saving early action for the people of Jamaica in the amount of 4 million. Now, of course, this is not anticipatory action, but what does this essentially help us do in cases where, for whatever reason, anticipatory action is not possible or not feasible? We're using all this information and this data to be faster. Usually, when you look at other situations and storm makes landfall, and people need to do what we just discussed earlier. They need to assess the needs, talk to the population, understand what the needs are, make a plan, go to the donor, and that can take weeks. And so I guess, what I'm trying to say here is that, we were still able to use this forecasting information to at least cut that time down to about 5 days. I think we want to stop here because time is running and questions are plenty. So maybe we stop here, and Hama, let us know how you would like us to go about the questions. I started typing and then I stopped, but I can continue. Thank you
No
so
worries,
much,
Regina.
everyone.
Thank you. Thank you to both of you. For those of you, I haven't had a chance to introduce myself, just to confirm that I'm not AI generated. My name is Hama Othman, and I am program manager with Harvard Humanitarian Initiative, IHHI. So I know we only have 6 minutes left, so I'll be cognizant of everybody's time. I'll try to read the questions in the order they were received, and I apologize in advance if we don't have enough time to go through all the questions. One last note, this is being recorded, and we will be sure to share the recording link via IHHI's LinkedIn page if you're interested in going back to the slides or just listen to the whole thing again, or share with friends or colleagues. So the first question that we received is from an anonymous attendee, and it says, do you use AI or machine learning for anticipatory action?
So to some extent, I mean, mostly in an indirect way, in the sense that the meteorological institutes around the world are increasingly building AI into their meteorological forecasts, which we use then for determining whether the triggers for anticipatory action have been reached. So for storms, for flooding, and also for seasonal forecasts, AI is increasingly used basically to make weather and seasonal forecasts. So mostly in that sense.
Thank you. And the next question is from Andrea. Could you kindly elaborate more on the providers of pre-arranged anticipatory action? What is the percentage going to INGO and NNGO?
Do you want to take this one?
Sorry, I was just typing. The providers of prearranged financing. So the providers of that financing could be, for example, the CERF, but there's also, agencies at the UN, like the World Food Program. They have anticipatory action funding that they use. FAO, the UN's Food and Agricultural Organization. There's also other pooled funds like the START Network. That's a sort of a group of NGOs that they have a pot of money for this sort of anticipatory humanitarian action. So these and then the Red Cross, Red Crescent movement, etc. So these are organizations that provide the funding. The recipients of this funding are also either the same ones, NGOs or WFP, FAO. In our case, for the CERF, CERF directly funds, we might have mentioned it, UN agencies. However, they then subgrant parts of the funding to implementing partners. And these implementing partners are NGOs, INGOs, so international and national NGOs, as well as Red Cross, Red Crescent movement. So that could be the Red Cross of a specific country. It could also be a part of a government, the Ministry of Health, for example, in a certain context. So while we can only directly give the funding to a UN entity, we are making sure that that funding then further trickles down to other entities that are also present in the country, have lots of knowledge, and implement activities. And that's what I have for that.
Thanks, Regina. And then the next question is from Pierre, and it might be the last. I hope not, but depending on the answer. But how do anticipatory action processes ensure that the voices of children and communities are central at every stage in order to foster respect and uphold their right to dignity?
Yeah, that's a really good question. And I'll give a short answer, but of course, it's a very complex topic. But basically, because we set everything up ahead of time, we have much more time to, involve communities, to listen to what their preferences and priorities are, and to also better target the anticipatory action, as opposed to waiting until an event happens and then having to scramble to, to provide a response. So taking the time beforehand allows us to better engage communities and better target the assistance.
Great. So we're almost at time. And again, apologies for the questions that we may not have enough time to answer. Like I said, the recording link will be shared via HHI's LinkedIn page, and you will be able to follow up with us from there. I just wanted to take a moment and thank you, our panelists again, Nicolas Rost and Regina Omlor, for taking the time, giving this great presentation. And I want to thank each and every one of our attendees. Thank you for joining the webinar. Thank you for your interest. And please get connected with us. We will have a series of webinars throughout the academic year. We would love for you to join us. We would love to start a conversation, continue a conversation, and for you to become part of our community if you are not already. Thanks again for joining, and we hope to see you soon at another webinar.
Thank you, Hama, and thanks to everybody.
Thank you. Thanks very much.